Question 1. In the context of radiation oncology, Mr. Thompson is undergoing treatment with an intensity-modulated radiation therapy IMA technique for a head and neck tumor. He has expressed concerns about the side effects related to the surrounding tissues, particularly the salivary glands. What should be the primary focus of the medical physicist when optimizing the IMA plan for Mr. Thompson's treatment? A. Minimizing the dose to the tumor while avoiding any damage to the salivary glands. B. Ensuring homogeneous dose distribution throughout the tumor to maximize tumor control. C. Maximizing the dose to the tumor while avoiding any dose to the salivary glands. D. Applying hyperfractionated treatment regimen to reduce treatment time. Answer. Correct answer A. Minimizing the dose to the tumor while avoiding any damage to the salivary glands. Explanation. In IMA, the primary goal is to deliver a highly conformal dose to the tumor while minimizing damage to surrounding healthy tissues. In the case of head and neck cancers, the salivary glands are critical structures that must be spared to reduce the risk of xerostomia dry mouth. The medical physicist should focus on optimizing the dose distribution to ensure that the tumor receives an adequate dose while minimizing the dose to adjacent structures such as the salivary glands. This approach is consistent with the principles of radiation therapy, where sparing normal tissue is prioritized to reduce side effects. The underlying principle is to balance tumor control probability (CP) with normal tissue complication probability (ETI). Question 2. Given the circumstances of advanced radiation oncology techniques, the use of proton therapy has gained popularity. Which of the following is the primary advantage of proton therapy over conventional photon therapy in treating certain tumors? A. Proton therapy delivers a uniform dose distribution throughout the tissue. B. Proton therapy provides a high dose at the tumor site with minimal exit dose. C. Proton therapy is less expensive than photon therapy. D. Proton therapy uses a higher energy than photon therapy. Answer. Correct answer. B. Proton therapy provides a high dose at the tumor site with minimal exit dose. Explanation. Proton therapy, a type of particle therapy, has a distinct advantage over conventional photon therapy due to the Bragg peak, which allows protons to deposit their maximum energy directly at the tumor site and minimize the dose to surrounding healthy tissues. This is particularly advantageous in treating tumors located near critical structures, such as those in the brain, spinal cord, or pediatric patients. The ability to deliver a high dose to the tumor while sparing normal tissues is the key benefit of proton therapy. In contrast, photon therapy typically delivers dose both at the tumor site and in the tissue beyond the tumor, potentially increasing the dose to healthy structures. Question 3. In terms of radiation dose measurement, consider a medical physicist performing calibration of a linear accelerator, LINAC. Which of the following dosimeters is most commonly used for absolute dose measurements in clinical radiation therapy? A. Thermoluminescent dosimeter, TLD. B. Optically stimulated luminescent dosimeter, OSCIL. C. Ionization chamber. D. Radiochromic film. Answer. Correct answer. C. Ionization chamber. Explanation. Ionization chambers are the most commonly used dosimeters for absolute dose measurements in clinical radiation therapy. They are used to measure the quantity of ionization in air produced by radiation, which can then be related to the dose delivered to the patient. The ionization chamber provides reliable, accurate, and reproducible results, making it the standard for calibration. LINACs, TLDS, and OSCILs are used more for relative dose measurements or for patient-specific CAR. Radiochromic films are often used for dosimetric verification, particularly in the case of complex treatment plans such as IMT. Question 4. While examining the principles of radiation interactions with matter, Mr. Roberts is concerned about the effects of electron beam therapy on the surrounding normal tissues in a breast cancer patient. What is the most significant factor that determines the penetration depth of an electron beam? A. The energy of the electron beam. B. The density of the tumor. C. The amount of shielding used. D. The angle at which the beam is delivered. Answer. Correct answer A. The energy of the electron beam. Explanation. The penetration depth of an electron beam is primarily determined by the energy of the beam. High-energy electron beams can penetrate deeper into tissues, while lower-energy beams are absorbed more superficially. This property is crucial in planning for electron beam therapy, as the energy is chosen based on the depth of the tumor and the need to spare surrounding healthy tissues. Electron beams, commonly used for superficial tumors, and their dose distribution drops rapidly with depth, making it important to select the appropriate energy to achieve effective treatment while minimizing exposure to normal tissues. Question 5. Based on the information from radiation safety guidelines, consider the use of a linear accelerator (LINAC) in a clinical setting. What is the primary purpose of using lead shielding around the treatment room? A. To reduce radiation exposure to the treatment staff and the general public. B. To ensure that the radiation beam is more focused on the tumor. C. To prevent backscatter radiation from reaching the patient. D. To prevent radiation from escaping the treatment room and causing skin burns. Answer. Correct answer A. To reduce radiation exposure to the treatment staff and the general public. Explanation. Lead shielding around the treatment room is primarily used to protect the treatment staff and the general public from unnecessary radiation exposure. It is designed to block scattered radiation and leakage from the LINAC, ensuring that radiation does not escape the room and expose individuals outside the controlled environment. According to principles of radiation protection as outlined in the ALARA principle, as low as reasonably achievable, shielding is a critical component in minimizing occupational exposure. This approach is mandated by radiation safety regulations, including the International Commission on Radiological Protection (ICOP) guidelines. Question 6. In an effort to improve treatment accuracy, modern radiation oncology departments utilize image-guided radiation therapy (IGRT). Which of the following best describes the advantage of IGRT in clinical practice? A. It allows for the visualization of tumor position and adjustment of the treatment beam in real time. B. It ensures that the radiation dose is distributed uniformly across all treatment fields. C. It reduces the overall cost of radiation therapy by using less sophisticated equipment. D. It provides continuous radiation monitoring during treatment delivery to minimize errors. Answer. Correct answer A. It allows for the visualization of tumor position and adjustment of the treatment beam in real time. Explanation. Image-guided radiation therapy (IGRT) provides real-time imaging of the tumor and surrounding structures, which allows the medical team to adjust the treatment beam to ensure accurate targeting of the tumor. This is particularly important for tumors that move or change position during treatment, such as in the case of lung cancer, prostate cancer. IGRT improves the precision of radiation delivery, reducing the likelihood of radiation dose being delivered to surrounding healthy tissues. While it may also assist in monitoring radiation dose, its primary function is to enhance the accuracy of beam alignment with the tumor. Question 7. Considering the development of modern radiation therapy techniques, Italy is undergoing stereotactic body radiation therapy (SRT) for a small lung tumor. What is the primary characteristic of SRT that distinguishes it from conventional radiation therapy techniques? A. The use of a larger number of smaller treatment fractions. B. The delivery of a high dose per fraction over a limited number of sessions. C. The use of proton beams instead of photon beams. D. The use of only X-rays for treatment delivery. Answer. Correct answer. B. The delivery of a high dose per fraction over a limited number of sessions. Explanation. Stereotactic body radiation therapy (SRT) is characterized by the delivery of a high dose of radiation per fraction, typically over a limited number of treatment sessions, often just 3-5 fractions. This contrasts with conventional radiation therapy, which typically involves daily treatments over several weeks with lower doses. Fraction. The high dose per fraction SRT is possible due to the precision of modern imaging and treatment techniques that allow for accurate targeting of tumors even in locations such as the lung where tumor movement due to breathing must be accounted for. Question 8. To better understand the principles of radiation dose measurement, consider the use of thermoluminescent dosimeters (TLDS). In which of the following situations would TLDS be most advantageous in clinical practice? A. When precise, real-time dose measurement is required during treatment. B. When measuring absolute doses delivered to the tumor during treatment. C. When assessing the dose delivered to patients outside the radiation field. D. When providing a permanent record of dose for retrospective analysis. Answer. Correct answer D. When providing a permanent record of dose for retrospective analysis. Explanation. Thermoluminescent dosimeters (TLDS) are commonly used for patient-specific dose measurements, particularly for retrospective analysis. TLDS are sensitive to radiation and can be read after the treatment to provide a permanent record of the radiation dose that was delivered to a particular area. Unlike real-time dosimeters, ionization chambers (TLDS) do not provide immediate feedback during treatment, but they are excellent for long-term dose tracking and assessment after treatment is completed. This makes them valuable for verifying and auditing dose delivery in clinical practice. Question 9. When considering radiation therapy for pediatric patients, the medical team must take extra precautions. What is the most significant consideration when planning radiation therapy for children? A. The potential for long-term radiation-induced secondary cancers. B. The higher cost of pediatric radiation therapy treatments. C. The use of higher energy radiation beams for better penetration. D. The possibility of faster tumor regression in children compared to adults. Answer. Correct answer A. The potential for long-term radiation-induced secondary cancers. Explanation. Children are more sensitive to radiation than adults due to their rapidly dividing cells and longer life expectancy, which increases the risk of developing secondary cancers later in life. Therefore, the most significant consideration when planning radiation therapy for pediatric patients is minimizing radiation exposure while still delivering an effective to treat the tumor. This may involve adjusting the energy of the radiation, using more conformal techniques like IMiD or proton therapy, and carefully choosing treatment plans that minimize the dose to surrounding tissues. Question 10. Under the assumption that a medical physicist is performing quality assurance, on a linear accelerator, LINAC, which of the following actions is typically performed during daily car procedures to ensure the proper functioning of the machine? A. Calibration of the radiation dose rate and energy spectrum. B. Verification of the radiation output using an ionization chamber. C. Assessment of the mechanical integrity of the LINAC gantry. D. Testing of patient-specific treatment plans for accuracy. Answer. Correct answer B. Verification of the radiation output using an ionization chamber. Explanation. Daily car procedures for a linear accelerator, LINAC, typically include verifying the radiation output using an ionization chamber. This ensures that the LINAC is delivering the prescribed dose accurately and consistently. Other daily checks may include verifying the alignment of the machine, ensuring that the imaging systems are functioning properly, and checking for any mechanical or software malfunctions. Calibration of the radiation output is crucial to maintaining treatment accuracy, and daily car tests help detect any deviations that may affect patient safety and treatment efficacy. Question 11. Given the circumstances in a clinical setting, a radiation oncologist is treating a patient with lung cancer using intensity-modulated radiation therapy IMiD. The physician is considering the potential risk of delivering radiation to surrounding organs, including the heart and lungs. Which of the following is the primary advantage of IMiD in this situation? A. IMiD provides better tumor coverage but does not reduce the risk of surrounding tissue damage. B. IMiD allows for highly conformal radiation delivery, minimizing dose to surrounding healthy tissues. C. IMiD increases the radiation dose delivered to surrounding normal tissues to ensure better tumor control. D. IMiD uses lower energy beams, reducing the overall dose to surrounding organs. Answer. Correct answer B. Explanation. IMiD is designed to deliver highly conformal radiation doses that closely match the tumor shape while minimizing exposure to surrounding healthy tissues. This is particularly important in organs near the target, such as the lungs and heart in lung cancer treatment. By modulating the intensity of the radiation beams, IMiD improves the therapeutic ratio by sparing healthy tissue, thus reducing potential side effects. This, with clinical guidelines emphasizing the need for precision in radiation delivery, which is a critical aspect of modern radiation oncology. Question 12. In the context of stereotactic body radiation therapy, a patient with a small, localized tumor is being treated. The physician aims to maximize tumor control while minimizing damage to surrounding tissues. Which of the following factors contributes most to the accuracy of dose delivery in SRT? A. The use of large field sizes for the radiation beams. B. High-dose radiation fractionation, which increases the total dose per session. C. The use of immobilization devices and image-guided radiation therapy to track tumor position. D. Decreasing the treatment time to reduce patient movement during the procedure. Answer. Correct answer. C. Explanation. The key to successful SRT lies in accurate targeting of the tumor, which is achieved through the combination of immobilization devices and image-guided radiation therapy. Immobilization ensures that the patient remains still during treatment, while it allows for real-time tracking of the tumor's position, which is particularly important when treating small, moving tumors such as in the lungs. This approach is in line. Current clinical practices, which stress the importance of precision in radiation delivery for SRT. Question 13. When considering the principles of radiation therapy, a clinician is treating a patient with external beam radiation therapy (ABR) for a brain tumor. The patient's tumor is near the optic nerve, and care must be taken to avoid damage to this critical structure. Which of the following best describes the concept of radiation tolerance in this scenario? A. Radiation tolerance refers to the amount of radiation the tumor can safely absorb without regrowth. B. Radiation tolerance is the dose that normal tissues such as the optic nerve can safely receive without sustaining permanent damage. C. Radiation tolerance is the maximum dose that can be delivered to tumor before it becomes resistant to further treatment. D. Radiation tolerance refers to the total dose that the tumor can receive in fraction. Answer. Correct answer. B. Explanation. Radiation tolerance refers to the maximum dose of radiation that normal tissues, such as the optic nerve, can safely tolerate without significant or permanent damage. This is an important consideration when planning radiation therapy, as exceeding this tolerance can lead to severe side effects, including vision loss in the case of the optic nerve. The concept is well documented in clinical radiation oncology guidelines, which include recommended dose limits for critical structures to minimize the risk of adverse effects. Question 14. Considering the growing trend in adaptive radiation therapy, a radiation therapist is using real-time imaging to adjust a patient's treatment plan during the course of treatment. Which of the following is the main advantage of ART in this context? A. ART allows for the use of larger treatment volumes, increasing the chances of tumor eradication. B. ART allows for daily adjustments to the radiation dose based on tumor shrinkage or changes in patient anatomy. C. ART reduces the need for image guidance during each treatment session. D. ART ensures that patients receive a uniform radiation dose over the entire course of treatment. Answer. Correct answer. B. Explanation. The main advantage of adaptive radiation therapy (ART) is its ability to adjust the radiation dose and treatment plan in response to changes in the tumor's size or position or alterations in patient anatomy during treatment. This is particularly useful for tumors that can change shape or position due to factors like weight loss or tumor shrinkage. The flexibility of ART helps improve treatment outcomes by ensuring that the tumor receives the intended dose while sparing normal tissues as much as possible. Question 15. During the process of quality assurance (CAR) for a linear accelerator (LINAC) in radiation therapy, a physicist performs routine calibration of the machine. Which of the following best explains the role of calibration in ensuring accurate radiation delivery? A. Calibration adjusts the radiation machine to ensure it can deliver the desired dose uniformly across all treatment sites. B. Calibration ensures that the machine is able to deliver a higher dose to tumors while reducing the dose to normal tissues. C. Calibration is necessary to make sure that the treatment room is free from external radiation sources. D. Calibration is primarily focused on checking the safety features of the machine, such as emergency shutoffs. Answer. Correct answer. A. Explanation. Calibration of the linear accelerator (LINAC) ensures that the machine delivers the intended radiation dose accurately and uniformly to the treatment area. It involves checking the dose output, beam energy, and alignment to make sure that the radiation is delivered as planned and meets safety standards. Proper calibration is essential for high-quality radiation therapy and is a critical part of quality assurance (CAR) procedure, as outlined by the American Association of Physicists in Medicine (OPM) and other regulatory bodies. Question 16. What factors contribute to the selection of a radiation dose fractionation schedule for a patient receiving radiation therapy for prostate cancer? A. The tumor's sensitivity to radiation, the patient's overall health, and the type of radiation being used. B. The patient's preference regarding treatment duration and the geographic location of the tumor. C. The size of the radiation machine and the time of day the treatment is scheduled. D. The cost of treatment, the patient's insurance coverage, and the hospital's budget. Answer. Correct answer A. Explanation. The selection of a dose fractionation schedule in radiation therapy is primarily determined by the tumor's sensitivity to radiation, the patient's overall health, and the type of radiation used. E.g., photon or proton therapy. In prostate cancer, hypofractionation is often used due to the tumor's lower sensitivity to radiation, while also considering factors such as tumor volume and the proximity of structures. Fractionation schedules are designed to optimize the therapeutic ratio, maximizing tumor control while minimizing damage to normal tissues. Question 17. In terms of biological effects of radiation, a patient is undergoing radiation therapy for a head and neck tumor. Which of the following is the primary factor influencing the tumor's response to radiation? A. The radiation dose rate and the type of beam used. B. The patient's age and prior treatments. C. The tumor's cellular oxygenation status and the presence of hypoxic cells. D. The patient's mental state and emotional response to treatment. Answer. Correct answer. C. Explanation. The tumor's response to radiation is heavily influenced by the oxygenation status of its cells. Tumors with low oxygen levels, hypoxic tumors, are less sensitive to radiation because oxygen enhances the effect of radiation in causing DNA damage. This is a critical factor in treatment planning, as oxygenated tumor cells are more susceptible to the effects of radiation. Hypoxic cells can often survive radiation treatment, contributing to treatment resistance. Question 18. As evidenced by current advancements in radiation therapy technology, a clinician is considering the use of proton therapy to treat a pediatric patient with a brain tumor. What is the main advantage of proton therapy over conventional photon therapy in this scenario? A. Proton therapy delivers a higher dose to surrounding normal tissues. B. Proton therapy provides better sparing of surrounding healthy tissue due to its unique dose distribution characteristics. C. Proton therapy allows for faster treatment times compared to photon therapy. D. Proton therapy increases the tumor control probability by delivering high doses of radiation. Answer. Correct answer. B. Explanation. Proton therapy offers a significant advantage in sparing surrounding healthy tissue compared to conventional photon therapy. This is due to the physical properties of protons, which deposit most of their energy at the tumor site, the Bragg peak, and very little energy beyond it. This characteristic makes proton therapy particularly valuable when treating pediatric patients whose surrounding healthy tissues are more sensitive. Radiation. The use of proton therapy is supported by guidelines focusing on minimizing radiation exposure to normal tissues, especially in younger patients. Question 19. The relationship between radiation dose and tumor control probability (TCP) is a critical factor in radiation oncology. What is the primary implication of increasing the dose per fraction in hypofractionation schedules for tumor control? A. Decreases tumor control probability but reduces the overall treatment time. B. It increases tumor control probability but also increases the risk of side effects to normal tissues. C. It has no effect on tumor control probability but leads to a lower total dose delivered. D. It increases tumor control probability by reducing the need for image-guided radiation therapy. Answer. Correct answer. B. Explanation. Increasing the dose per fraction in hypofractionation schedules can improve tumor control probability (TCP) because it delivers a higher dose of radiation in fewer fractions. However, this strategy also increases the potential for radiation-induced side effects as normal tissues are exposed to higher doses per treatment session. Balancing ECP and normal tissue complications is a key consideration. Radiation therapy, especially for tumors that are more resistant to fractionated doses. Question 20. Throughout the course of radiation therapy, a patient is experiencing significant fatigue as A side effect: which of the following is the primary cause of fatigue in radiation therapy patients? A. The cumulative effect of radiation on normal tissues and the body's immune response. B. The patient's increased anxiety about the treatment process. C. The dose of radiation being delivered to the tumor. D. The use of medication during radiation therapy. Answer. Correct answer A. Explanation: fatigue during radiation therapy is primarily caused by the cumulative effects of radiation on normal tissues as well as the body's immune response to the treatment. This side effect is common and can be exacerbated by factors such as the radiation dose, the area being treated, and the overall health of the patient. Proper management of fatigue includes addressing the physical, psychological, and emotional needs of the patient, as outlined in radiation oncology care guidelines. Question 21. A patient undergoing radiation therapy for a pelvic tumor has been experiencing discomfort from bladder irritation due to the radiation. Which of the following strategies is most effective in reducing bladder toxicity during treatment? A. Increasing the radiation dose to the bladder to improve tumor control. B. Using a larger treatment field to include a larger safety margin around the tumor. C. Encouraging the patient to empty the bladder frequently before and during treatment. D. Reducing the number of radiation fractions to minimize total radiation exposure. Answer. Correct answer C. Explanation: bladder irritation is a common side effect of pelvic radiation therapy. To minimize this, patients are often instructed to empty their bladder before treatment and to drink a specific amount of water before their sessions. Keeping the bladder full can help displace it from the treatment field, which reduces radiation exposure to surrounding normal tissues. This is a standard approach in managing radiation-induced bladder irritation. Question 22. During the planning phase of a radiation therapy treatment for a lung cancer patient, the oncologist is concerned about radiation exposure to the heart. Which of the following techniques is most commonly used to spare the heart while ensuring adequate tumor coverage? A. Hypofractionation to minimize the number of treatments. B. Intensity-modulated radiation therapy IMA to deliver precise radiation to the tumor. C. Large treatment fields to ensure all tumor margins are covered. D. Whole lung irradiation to treat the tumor and surrounding tissue. Answer. Correct answer B. Explanation: intensity-modulated radiation therapy IMA is widely used in lung cancer to precisely target the tumor while minimizing the dose to surrounding organs such as the heart. IMA adjusts the intensity of the radiation beams to conform to the tumor shape, which helps protect critical structures. This is a common strategy in radiation oncology for tumors located near sensitive organs. Question 23. In a process of external beam radiation therapy (EBR) for breast cancer, a patient is receiving treatment to the left breast. The radiation oncologist is concerned about the potential risk of cardiac toxicity. Which of the following techniques is used to reduce this risk? A. Treating the patient in the supine position with the arms raised above the head. B. Increasing the radiation dose to the left breast to ensure full tumor control. C. Using a larger treatment field to encompass the entire breast and surrounding tissue. D. Treating the patient while lying in the prone position with the breast hanging below the chest. Answer. Correct answer A. Explanation: the supine position with arms raised above the head is commonly used in breast cancer treatment to minimize radiation exposure to the heart. By positioning the breast in a way that the heart is displaced inferiorly, radiation to the heart is reduced, which helps decrease the risk of cardiac toxicity. This is a standard technique in clinical radiation oncology when treating left-sided breast cancer. Question 24. A patient undergoing radiation therapy for an abdominal tumor is at risk for bowel toxicity. Which of the following strategies can help minimize radiation exposure to the bowel during treatment? A. Increasing the fraction size to limit the total treatment duration. B. Using deep inspiration, breath, hold, dip techniques to displace the bowel away from the treatment area. C. Delivering radiation with a larger treatment field to cover more of the tumor. D. Administering chemotherapy alongside radiation to reduce bowel damage. Answer. Correct answer B. Explanation: deep inspiration, breath, hold, dip is a technique used to displace the bowel away from the treatment field during radiation therapy. By asking the patient to hold their breath, the tumor and surrounding tissues, including the bowel, move into a more favorable position, thereby reducing the risk of radiation exposure to the bowel. This technique is commonly used in abdominal radiation treatments to minimize side effects. Question 25. A patient receiving radiation therapy for a brain tumor is at risk for cognitive decline due to radiation exposure to the hippocampus. Which of the following strategies could be used to minimize damage to the hippocampus while still treating the tumor? A. Increasing the radiation dose to ensure complete tumor eradication. B. Using proton therapy to reduce the dose delivered to the surrounding healthy tissue. C. Administering chemotherapy concurrently with radiation to protect the brain. D. Treating the tumor in fewer fractions with larger doses. Answer. Correct answer. B. Explanation. Proton therapy has an advantage over traditional photon therapy in sparing surrounding healthy tissues, such as the hippocampus, due to its unique dose distribution characteristics. The Bragg peak of protons allows for precise delivery of radiation to the tumor while minimizing exposure to surrounding normal tissues. This is particularly beneficial in the brain, where protecting critical structures like the hippocampus is to avoid cognitive side effects. Question 26. The radiation oncologist is planning treatment for a patient with a prostate tumor. The tumor is located near the bladder and rectum, both of which are critical structures. Which of the following methods would be most appropriate to minimize radiation exposure to the bladder and rectum during treatment? A. Hypofractionation, using fewer but larger doses of radiation. B. Utilization of image-guided radiation therapy (IGIT) to ensure precise tumor targeting. C. Increasing the field size to ensure the entire tumor is treated. D. Treating the patient in the prone position with immobilization devices. Answer. Correct answer. B. Explanation. Image-guided radiation therapy (IGIT) is crucial for precise targeting of the tumor in prostate cancer while minimizing exposure to surrounding organs like the bladder and rectum. IGIT allows for real-time imaging during treatment to confirm the tumor's position and adjust the radiation beam accordingly. This technique improves the accuracy of radiation delivery and reduces the risk of radiation toxicity to normal tissues. Question 27. A patient is being treated for an early-stage breast tumor using partial breast irradiation (PBI). Which of the following is the primary advantage of PBI over whole breast irradiation? A. PBI delivers higher doses to surrounding normal tissues. B. PBI requires a longer treatment time compared to whole breast irradiation. C. PBI results in fewer side effects by irradiating only the tumor bed. D. PBI, a more effective treatment for metastatic breast cancer. Answer. Correct answer. C. Explanation. Partial breast irradiation (PBI) targets only the tumor bed, which reduces radiation exposure to surrounding healthy tissues. This approach is associated with fewer side effects compared to whole breast irradiation, which involves irradiating the entire breast. PBI is typically used in early-stage breast cancer patients who are candidates for breast-conserving surgery and want to minimize radiation exposure to healthy tissues. Question 20. In radiation oncology, when performing a treatment plan for a patient with a complex tumor near critical structures, the radiation oncologist may utilize the concept of dose escalation. Which of the following is the main goal of dose escalation in radiation therapy? A. To reduce the overall treatment time by delivering a higher dose per fraction. B. To increase the radiation dose to the tumor while minimizing damage to normal tissues. C. To deliver the maximum possible dose to all tissues in the treatment field. D. To reduce the total number of treatment sessions required. Answer. Correct answer. B. Explanation. Dose escalation is used to increase the radiation dose to the tumor in an effort to improve tumor control probability (TCP) while minimizing the dose to surrounding healthy tissues. This approach is particularly useful in cases where the tumor is resistant to lower doses of radiation. Dose escalation is carefully planned to avoid exceeding the tolerance of nearby critical structures, thereby maximizing the effect of the treatment. Question 29. A radiation therapist is working with a patient undergoing radiation therapy for a tumor located in the abdomen. The patient has been instructed to follow specific instructions regarding their bladder and bowel status. Which of the following is the primary goal of these instructions during treatment? A. To ensure that the tumor is adequately treated and the surrounding tissues are protected. B. To minimize the patient's overall radiation exposure by reducing the number of treatment sessions. C. To reduce the patient's anxiety about the treatment process. D. To ensure that the patient experiences no side effects from radiation. Answer. Correct answer A. Explanation. Bladder and bowel instructions are designed to optimize the position of the target tumor and reduce radiation exposure to surrounding normal tissues. For example, a full bladder can help push the small bowel away from the treatment field, which is important for minimizing side effects. By carefully managing these factors, radiation oncologists can deliver precise treatment while sparing healthy organs, which is key in achieving optimal treatment outcomes. Question 30. During the course of radiation therapy, a patient develops skin reactions such as erythema and dryness in the treatment area. Which of the following is the most common cause of these skin reactions in radiation therapy patients? A. The patient's overall health and immune response to treatment. B. The radiation dose delivered to the skin and the area of treatment. C. The presence of infection in the treatment area. D. The use of chemotherapy alongside radiation therapy. Answer. Correct answer. B. Explanation. Skin reactions such as erythema, redness, and dryness are common side effects of radiation therapy and are primarily caused by the radiation dose delivered to the skin and surrounding tissues. These reactions occur due to the damage to the skin cellular structures, which can be exacerbated by factors such as the location of the tumor and the cumulative dose of radiation over time. Proper skin care is important in managing reactions